properly.
All right, let's move on to a different conversation and talk about the health crisis in the country. It's day 8, and the doctors are on strike. It's just escalating every other day. Kagiri, start us off on this. What do we seem to be getting wrong in the health sector, and who is to blame for this crisis?
Trevor, for me, I would think the person to blame is the lack of resources, because we already understand we have a serious shortage on medical practitioners in this country. I understand our shortage now stands at around 38,000 doctors. The ones ready to go into employment are 3,000. We don't even have salaries for them. So I think, again, my guess was that with the Social Health Insurance Fund, we could be able to cover up spaces like that and get more resources which would support employment of more doctors. But that said, Trevor, last year I had a very unfortunate situation where I had my father in hospital for a whole month. And it forces me to think of a patient who, of a close relative who has a patient in hospital at a time like now. So I think first we need to stop the blame game and put ourselves in situations of people like that. I think it was a day ago I heard of a doctor who, once the doctors went and took him out of Kenyatta University Teaching and Referral Hospital, he left an expectant mother on top of the operation table, only to learn later that she was espoused to a doctor colleague. So I think as we discuss all these issues, let's remember there are people affected, and these people are dear to the patients in these hospitals. But that said, it is my prayer today that we are having the one government approach meeting that has been called by the head of public service. And my prayer is that by the end of evening, we should have a resolution to all this, because I believe they've involved the Treasury, the Education Department, the Labour Department, the Ministry of Health, and I believe the KPMDU will also be there. So it's my prayer and my hope that this thing gets resolved today to avoid more suffering to Kenyans. Is
this a lack of resources or a lack of proper prioritization? Because there are those who say that there is money for renovations at State House, for example. There is money for entertainment, for example. Why is there's money for travel? In fact, the president himself complained about some people were still gobbling too much money traveling around. And yet we don't have money for the health.
And that's why I believe with today's meeting, a resolution will be found, because this is where also Treasury is challenged.
Yeah.
Rather than do this, why don't you allocate money to these other departments?
But did it have to get to this level?
It shouldn't, and that is what I'm saying. Beyond this, let's not go to a blame game, and just hope a resolution is found.
Is the government failing on this health, Kagiri?
I believe the government is committed to finding a lasting solution, because if you follow up on this, it is actually in regard to the CBA that was previously done. That is where all these issues are coming up. Yes, in 2017. So let us hope a resolution is found today, Trevor, because we're all hoping for the best for the country.
Okay.
Yeah.
Irungu, what are we getting wrong in this health sector as a country?
So there are two facts. The first is that the current dispute in terms of the health sector, it really goes back, as Jane has said, back to 2017, to that very long strike, if you remember, that we all suffered through. And that collective bargaining agreement has never been implemented. And I think that's the first thing. Now, whether you say that was a Jubilee problem that has been inherited by Kenya Kwanza, the fact of the matter is now Kenya Kwanza is the national administration. So like Jane, I am really looking forward to a breakthrough today in terms of the agreements. I think the second point is there is a myth that there is no money in government. And I think we have kind of bought into another fact, which is $7 out of $10 is being used to pay back debts that were incurred by the last administration. Whereas that is true, the fact of the matter is that there is still money being found for various things. You've mentioned the renovation of State House. I think it's important to point out, last year the presidential dais cost 100 million shillings. This week, I think it is, we've heard from the Treasury that the State House has basically overspent by close to $500 million shillings. We are constantly amazed by how many people it takes to inform a climate change negotiation, how many people it takes to attend a women's rights conference, as is happening at the moment in New York. So I think the fact of the matter is that there is money in government. The question is, how are we prioritizing it? And I think to look at the health sector, we have to look at this as I think it's the nation that has done quite a good job in terms of fleshing out what are the 4 or 5 issues that are very important. The first is that, private hospitals, particularly in the rural areas, have started to reject the National Health Insurance Fund. There is a 7-day ultimatum from the Kenya Medical Association on e-TIMS. There is also the legal challenge on SHIF that is happening. And as Amnesty International, we've looked a little bit closer at one aspect of SHIFT, which I think is somehow forgotten, which is the issue around data privacy, health data privacy, and the extent to which the SHIFT laws have taken in account the obligations that come under the Data Protection Act to make sure that you and I and everybody who's watching us, that our health details are not somehow sold to pharmaceutical companies abroad or somehow released in a way in which we are personally identifiable. The third area really relates to, we've talked about, is the strike. So if you put all these four together, it seems to me that we are at a point where even a national health conference with key parties is probably overdue. I think we need to probably bring together practitioners, advocates, and advocates not lawyers like Tom here, but people who advocate for the right to health, which includes Tom, I think, but not from a senior counsel perspective. But I think that's what we need, is that, it just seems to me that there are too many discordant voices around the right to health at this moment, when, to be honest, it is one area that is impacting on us, universally. I mean, it's one of the greatest perils for us financially, not even the 1.5 housing levy, but the fact that one of our members of our family could get sick and not have insurance.
When you see a standoff between the CS for Health and the KMPD officials, everybody speaking at loggerheads and they can't somehow meet, who between these two should bear the blame for this, and who should tamper and thaw the relationship, for example? Who should be the bigger person?
I think everybody should be bigger. I think this may sound strange, but I don't think there is an obligation on state officers to be more magnanimous, caring, compassionate, and honest. I think everybody has to bring honesty to the table. But the difference, I think, is that when you are a cabinet secretary, you have an entire ministry, and the data and the information and the budget of a ministry to be able to do something about that. I think for the Kenya Medical Practitioners and Dentists Union, they just simply have to say the doctors are paid way too low. The collective bargaining agreement has not been implemented, and we're now into the, the 8th year. And medical interns, many of them, including some of my neighbors who have really worked their way through education and have chosen not to leave the country. I mean, this is the thing we keep forgetting, that our medical practitioners, our doctors, our nurses, our medical assistants, they are choosing not to leave this country. They are choosing to work here. The question is, can we create the conducive environment for them to continue to treat Kenyans rather than have them in flight and in an exodus to places like Canada, the UK, Botswana, and elsewhere. And therefore, then we are starting to beg other countries for their doctors. I
asked that question because on one side, there are those who have taken the Hippocratic oath to save lives. And there's also, on the other side, someone who's taken an oath to take care of the people and the docket she's supposed to be leading. So who should cede more ground? That's what I'm trying to find out.
The Hippocratic...
They're both held by oath.
So one is held by the Hippocratic Oath, the other is held by Chapter 6. Right? Which is that there is a leadership responsibility to use public resources effectively and for the human rights that are contained in the Bill of Rights. So I think that's the issue. Sometimes I think doctors, when they take this course of action, and I had the opportunity to meet with Secretary General KMPDU Davdi Binji about 2 weeks ago in hospital after he was shot by a police officer simply for raising this issue on the streets of Nairobi. And I asked him, how do you feel calling for a strike? And he was very clear. He said, listen, this is always our last resort. If there is something that pains doctors most, is withdrawing services, because like Jane, they know the impact of that on human beings. But the point is, if you reach the state in the industry where you do not have neither the medical facilities, you do not have the salaries, you do not have the, the tools to be able to do your work, at some point as a medical union, you have to declare enough is enough, let us stop, reset the system, and then go back to providing services.
Okay. Prof, what are we getting wrong here in the health sector?
Trevor, maybe I could rephrase the question, what are we getting right?
Do you think there's something we're getting right?
Yes, what we are getting right
of a strike
is that we have a new legal framework, and that is right.
Which the doctors themselves reject.
The doctors,
doesn't cover them.
The doctors do not want to subscribe. They've rejected e-TIMS, as we've said, electronic tax invoice system. There's some level of accountability there that is on the play. For me, what is important here is that there's a delay in settling the industrial question on how much should doctors earn. For me, that is the key issue, because that is what the union is saying is unsettled, that the offer on the table is not sufficient or is not good enough as set out in their requests or in their demands, if you may. My concern, and borrowing from the Hippocratic Oath that you referred to, doctors, I think, should have a higher calling in terms of service delivery because they deal with life. And to that extent, I expected the disputation between doctors or the union and the ministry not to drag as long as that one of teachers, because the other strikes we're used to are those of teachers. But for doctors, I thought there's a bigger concern, and doctors earn fairly well. Doctors earn more than teachers. They earn a very good salary. From the schedules I'm seeing, the intern doctors and doctors earn. Now, the only problem here, and we've had this before, and we had Cuban doctors brought into the country because of these strikes. We have had a growth in the private health sector because every person who is able to afford health treatment will now fall off or go to a private doctor. Now, of course, the common Mwananchi is suffering because they go to public hospitals. Now, and that is the calling I would make to the union, that they're hurting the common person. There's need for a quick settlement so that doctors go back to work. But it also raises a point on regulation. Doctors strike at the counties because health service is devolved. Perhaps there's need to call back or to recall the health. If counties cannot manage health, can we bring back this service to the national government? Now I think it's time to have that conversation. That's the time. It's time to have
referendum.
To have that conversation, because if counties are clearly unable to manage doctors and hospitals cannot run, then perhaps it is time for the national government to start thinking of a new framework or to manage health. Which would lead to a referendum because it's the Constitution. Yes, we do. But well, even the amendments, what we see here also require a referendum. It may be a question to think about, because health is key to our people. Our people cannot go around, those who cannot afford to be treated, those who use the NHIF card. I can see some hospitals rejecting NHIF cards. We have some litigation around the SHIF. Now, these things have to be settled. And I think I would urge the minister, C.S. Nakumicha, to be firm with the union. This thing must come to an end. I know there's litigation going on. I saw my learned friend, Senior Counsel Fred Ngati in court. We need to settle this health question for the interest of the public. Okay. Manzo?
Well, unfortunately, the Department of Health has been mismanaged. First and foremost, health is devolved. The national government has refused to devolve health. They have refused to let the Council of Governors, the governors themselves to handle health, and they have remained with a lot of things at the national level. Unfortunately, they are unable to handle them. Doctors are very sensitive. You don't train a doctor overnight. It is a sacrifice of their own lives, and they deal with life. They deal with Kenyans, and therefore, their issues should be heard. What has happened, instead of following Article 159, where you bring all the issues to the table and handle them, the government has decided to rely on technicalities to frustrate doctors more. They have shown ill will. Why? Strikes are in the Constitution and they're allowed. When somebody is picketing peacefully, why will you shoot them on their head? That is even intending to kill. The moment you show that that is ill will on the part of government, then you go now to pretend to negotiate with somebody who had shot and you underpay them. They cannot afford houses themselves. And then even more important, you'd see just like lawyers, you have to train a doctor. They have to go to, attachment, for a year with qualified doctors so that they can learn. It is a very delicate thing, even to learn to operate on somebody or even a neurosurgeon on the head, you really have to be retrained and retrained and retrained. So when this component is missing and even the money for this is missing, and by the way, this country has a lot of money. It's not that a lot of our taxes are going into corruption. And even the mechanical system of health has been mismanaged. You have, equipments which don't work and have been put with these doctors, scans. So there's such a mess. And if Nakuminja is unable to settle this matter, I think she should resign and allow other Kenyans who are competent enough to deal with the health issues.
Yeah, but is it time to have this conversation that Prof is saying that maybe health should be reverted back to the national government?
Well,
yes,
what we should have is a health commission, and the doctors are pushed for this. Let's have a health commission which will handle the matters in the counties and the matters in the national government. It is all that the government has been difficult. Let the government let health be dealt by the counties. Okay. What is Nakuminja doing in health? All these matters should be settled by the governors and COG. Okay. But they have stuck to it, and that's why I'm saying, for mismanaging the health sector, if she's unable to settle this matter and Kenyans are dying, she should resign.
Kagiri, is it time to have that conversation, that healthcare maybe should be reverted back to national government? Has it been mismanaged at the county level?
No, I believe it's time to have a conversation. And the conversation starts today, at today's meeting.
Okay. You don't want to get into it because you don't think it should be reverted.
No, let the conversation begin.
See how careful he's being with that.
Looking for resignation.
He's unable to settle the matter.
I think on this one I'm a devolutionary, in the sense that I think there were very solid reasons for bringing services closer to the people, and part of that was accountability and an ability for people to be able to, through public participation, design health clinics and health sectors in a way that is actually responsive to what people needed. So I think pulling it back to the national, or recentralizing it, I think is A, costly in terms of a national referendum, B, undesirable in the sense that I have no confidence that by taking it back to the center, we will really have a better health system, or will we just see the same repetition of what we had previous to devolution? I think it's very important that that government agencies at this moment, led by the CS, do not threaten doctors, do not threaten the unions. We know what that produced in 2017, the longest strike in history. Several law cases, Amnesty provided legal advice for the leadership of the KMPDU back in 2017. We are prepared to do that again if their rights are infringed. Strike is a legitimate protest tool of people who are concerned about the state of public affairs. But threats and intimidation at this point is not helpful.
Okay, let me bring in some feedback real quick and then take closing remarks. We're running out of time here. Let's see what you're saying online at Trevor Mbija at Citizen TV Kenya. Use the hashtag Daybreak, and then I'll give my panelists a chance for closing remarks. Engineer Lazaro says KK government pretends to be pushing for universal health coverage without looking into the plights of medical providers in state of health centers around the nation. Senator Ojienda, you're slowly becoming a sycophant. Okay, you'll get a chance to respond to that. Yumuri says there's no way for the government to claim there's no money for medical internship while hiring CASs. Yeah. Unnecessary expenditure on CASs and other wasteful avenues need to be curtailed to allocate funds for medical interns. Okay. Caleb says the government of Kenya better solve this crisis in totality. There is more crisis come June when over 5,000 health workers under UHC contracts expire. The governor has requested their contracts be renewed for 3 years, but MOH did 1 year. Okay. Bob Otieno Wino says doctors don't want to be under county government but national government. Once the health docket will be reverted back, the strikes will ease with immediate effect. Okay. Remy Butia says, using international standards, the gap between the staff recommended to offer optimum quality services vis-a-vis the staff actually available to offer the services has been a crutch in ensuring Kenyans receive health care. Okay. Closing remarks, and Prof, I'll start with you.
Trevor, I think that we need to fix both the health sector and also give renewed hope to Kenyans. And I think I must acknowledge that we also need to preach the message of hope because the economy is improving. And that is factual. From where I sit as a senator for Kisumu, I have a responsibility to my people. And leaders, and all of us on this table, leaders, have a duty to ensure that whatever opportunity we have, either through CDF or members of parliament, the gender GAF fund, and other funds that we have access to, work for our people.
Okay.
But for now, let us embrace affordable housing, as this is one of the achievables, or what must be achieved under Article 43 of the Constitution.
Okay. Right.
Thank you.
Manzo?
Well, I want to say that Kenyans have really gone through a very difficult moment, and things are not becoming better. You know, the most important thing is somebody to be alive, is somebody to be healthy. You know, if you don't have a healthy nation, you cannot create wealth at all. Therefore, the health sector is extremely important. We have a very big problem when it comes to, we collect a lot of monies, we have a lot of monies, but there's a lot of corruption, and there are many, many channels for corruption, like even the so-called new affordable houses. They are just channels for corruption being created to enrich a certain people. Similarly, you know, with the health sector, there are so many channels being created to, you know, to have corruption, to make some people richer than others. The most important thing, we must hear, you know, what the doctors want, so that they're in their best condition to serve the nation. I still repeat, if the Minister of the CS for Health is unable to sort out this problem, as you know, in the fastest way possible, she should only resign and let another person handle this.
Okay. Irungu?
So I started the conversation really saying that we are in a troubled time, and there are glimmers of hope. There are things that are beginning to work. I think it's important to recognize that, you know, the dollar has gone down against the Kenya shilling. Cost of living for certain categories of people has got better, and I think Jane made this point very clearly for me. I think the argument around affordable housing and the right to or universal healthcare remains really the aspiration of our nation, not just the Kenya Kwanza administration and the 47 governments. The question is how and to the extent to which the public is carried along with the proposals that are there. I wanted to end up on one issue, which is to just acknowledge that at this time there is a lot of tension, and state officers under quite a bit of pressure to perform. Many of them are beginning to think about their second terms, not just at the national level, but even at the county level. And we're starting to see what I would call behavior that, Tom would probably have the right name for this, but is slightly malicious and aggressive. So at the moment, you know, we have a senior council that is suing the judiciary for large sums of money, much of which will come from our salaries. We have a governor who is suing a public interest campaigner who took him on in terms of the buildings around Kilimani. We have protesters that heckled governors and the presidents of the president, who are now being charged for I'm not even sure what that charge was.
And a governor suing a witch doctor. A governor suing a witch doctor.
And to make it worse, even a governor is suing a witch doctor. So I think the point is just to acknowledge that this is the season of dissent.
Yeah.
And it's very important that we do not slap down the freedom of expression, the freedom of the right to disagree in this moment, but really elevate the arguments that are compelling, that allow people to move with government on particular projects, rather than slap them with these very onerous charges.
Okay. Kagiri will give you the final say.
Thank you, Trevor. For me, I would want to say we are at a better time than we were when we spoke last year, and we are looking forward to better times. We know we are not where we should be, but we'll keep striving to get to where we should be. But as leaders, let's give hope to our people, because it is hope that people live from. And finally, let me say Happy International Forest Day to Today it's been marked in my county Laikipia, so that's where I'm headed from here. And I'm told you grow trees, you don't plant trees.
Okay.
Yeah, you have to nurture them. Thank you.
All right, thank you so much for making time this morning. Honorable Professor Tom Ojienda, Senator for Kisumu, Honorable Dan Manzo, Senator for Makueni, Honorable Jane Kagiri, Woman Rep for Laikipia and Irungu, Houghton, Executive Director, Amnesty International Kenya. Thank you so much for having a conversation with us on the state of the nation, and thank you all for the feedback that you've sent through. We appreciate it every single day. Coming up next is Cooking Tips. Bye for now.